Good morning, everybody. Dr. Rayfish here from Vet Triage. It is Saturday, November 2nd, 8:36 a.m. Pacific Time. We are going through this journal, this issue of JAVMA. This is the May 15, 2018 issue, and we're going with the Pathology in Practice. This is a 9-week-old male domestic shorthair that presented for a proliferative lesion within the left orbit. Proliferative means that it's kind of expanding since the cat was adopted at 8 weeks of age, so it's been there for at least a week. The only other symptom was sneezing. On physical exam, the left palpebral fissure, the palpebral fissure is the space between the eyelid margins, was dramatically widened by a firm, tan, multilobulated, meaning kind of bumpy, mass that partially filled the orbit and displaced the globe caudally, resulting in lagophthalmos. That was pushing of the eye. The mass also extended into the bulbar conjunctiva. That's the tissue that covers the back of the eye, where it was dark red and tan, smoothly marginated and adherent to the medial orbital rim. So it was towards the inside part of the eye, of the globe. The globe was displaced caudally, but was grossly normal, and the exposed conjunctiva was pink and moist. They performed excision of the mass with enucleation of the globe by a transconjunctival approach, and the cat did well. On histopathological evaluation, the neoplasm was included a foci of haired skin embedded with sheets of white and brown adipose tissue, that's fat tissue, focally extensive areas containing abundant large ganglion cells, that's nerve cells, randomly scattered within neuropil. It also had clusters of mucinous glands. It contained bands of skeletal muscle, islands of cartilage, trabecula of bone with bone marrow, bands of transitional and respiratory epithelium, and poorly differentiated spindle cells. And so for those who care about the cellular part of it, it sounds like it's just a mess of different cell types, which had a strong immunoreactivity for neurofilament protein within the neuropil surrounding the ganglions, and that's from immunohistochemical staining. So the end diagnosis is orbital and third eyelid or extragonadal teratoma in a young cat. Extragonadal means outside of the gonads, outside of the genitalia. So teratoma is the diagnosis. So comments. Differential diagnoses include orbital teratoma, focal inflammatory reaction like a foreign body granuloma or an abscess, conjunctival inclusion cyst, primitive neuroendocrine tumor, lymphoma, mast cell tumor, adenocarcinoma, squamous cell carcinoma, soft tissue sarcoma, and those include fibrosarcoma and myofibroblastic sarcoma. Of all of this long list, the only one that really makes sense with a young animal is orbital teratoma, inclusion cyst, primitive neuroectodermal tumor, or inflammatory lesion. So now let's talk more about these germ cell tumors. Germ cell tumors, also known as dysgerminomas, seminomas, and teratomas, most commonly arise in the genital region because they're composed of embryonic germ cells that normally differentiate into spermatogonia and oogonia. So the cells that become sperm and eggs come from germ cells, and germ cells usually located in genitalia. However, during embryonic development, germ cells can become ectopically distributed, meaning spread around the body outside of where it's supposed to be, which may result in partial somatic differentiation, meaning that the germ cells that normally become reproductive tissue end up turning into non-reproductive tissue, also known as somatic cells. So they can result in partial somatic differentiation of tissues in abnormal locations. Extragonadal teratomas are best described as an arbitrary, misplaced compilation of well-differentiated tissues containing more than one germ cell layer. And that's true of this one, right? We had cartilage, we had bone, skeletal muscle, skin, hair. The cells of these teratomas do not share the functions of the organs they resemble. Skin, bone, cartilage, teeth, glands, muscle, fibrous tissue, nervous tissue, and other types of epithelium have been reported. In this cat, the tumor contained well-differentiated mesodermal, ectodermal, and endodermal tissue. Those three words, mesodermal, ectodermal, and endodermal, are the three broad categories of what your cells can become in the body through embryonic development. And that forms everything in the body from there. So all of your parts, organs, everything, they all come from one of those three segments, one of those three categories. In human medicine, they differentiate these as either immature and benign or either mature and benign or immature and malignant. And the mature and benign ones are the most common. Infants will be affected by this, or you can see them within the ovaries of women of reproductive age. Immature malignant teratomas resemble embryonal tissue and are rapidly growing, locally invasive, and metastasize. Ovarian teratomas are graded in women histologically on a scale of 1 to 3. That's based on the amount of immature neuroepithelium present and is associated with the risk of metastasis. Non-germ cell malignancies with teratomas in humans are apparently chemoresistant. Domestic species are rarely affected, but when they are affected, they're typically benign. Orbital teratomas have been reported in children. They are benign unilateral masses, and they are typically seen in the left eye of females. That's so weird. That's the left eye. And the kids will have unilateral proptosis, meaning the eye is being pushed out at time of birth and can compress the globe over time. If you don't remove the eye, then you can get vision loss. A more radical approach of exenteration has been performed in severely affected children in whom tumor components had deeply infiltrated the retroorbital tissue, encasing the optic nerve. I have a video on this channel from a few years ago to talk about the 3 different types of eye surgeries that you can perform. I can't remember the third one, but exenteration, enucleation, and then there's a third one. There are only 3 other reports of extragonadal teratomas in cats, and they all were affecting the head. Retrobulbar teratomas have been reported in other species. These include lesser kestrel, the great blue heron, chicken, and a turkey. And the turkey had it in the left eye as well, and this kitten had it in the left eye. And that's it. And that's the paper. So it seems like if you diagnose one of these rare conditions, it is curative with removal from surgery. So we'll see you guys again tomorrow for another one. Thanks for those who watched the playback. Please continue to spread the word, share, and subscribe, and do all those things. Thanks. Bye.